Your research, you go into nutritional options for some of these behavior conditions. Is there a certain nutrient that these patients might be deficient in? Is that what you're finding, or is it something else?
Well, it's individualized.
Okay.
ADHD is a name given to several completely different conditions, and one has to find out what their individual biochemistry is. Probably the most common thing we see is zinc deficiency. I would say 90% of the children we've seen with ADHD, whether it's academic or behavior, are either low or very low in blood zinc levels. So one of the things we always want to do is normalize that. Now, people who are low in zinc tend to be elevated in copper. Copper tends to be high in people with hyperactivity and ADHD. So I think it's 68% of all ADHD cases, and we have a huge chemistry database for these people, are unusually high in copper. Well, copper has a direct effect on the synthesis of norepinephrine, which is an important neurotransmitter, and it comes from dopamine. And if you're high in copper, you'll be low in dopamine and too high in norepinephrine. And that means anxiety. And actually, what Ritalin does is elevates dopamine. Well, we can also adjust the neurotransmitters by just normalizing their metals, not necessarily having to go to a foreign molecule with side effects.
So in a bigger picture, it seems like we've seen a rise in these behavior conditions over the last, 20 years, give or take. Does that correspond to deficiencies then? Is there some sort of reason why the two are connected?
I think the biggest problem is overdiagnosis. The National Institutes of Health and the National Institute of Mental Health and the Center for Disease Control, they say that the actual incidence of ADHD in children is about 8 or 9%. They used to think it was 4.5%. Well, now they're saying 8 or 9%. Well, there are entire cities like Wheaton, Illinois, which is near where I live, 38% of all the children are taking stimulant medication. And if you go to West Virginia, and there are entire states where there are maybe 5 times as many people taking the medication as actually have the condition. So there's an extraordinary amount of overdiagnosis, misdiagnosis, and use of medications where it's really not appropriate. Mm-hmm. And then, of course, there are those who actually have the condition and do benefit from the medications.
So if we're talking about, in a lot of cases, a deficiency of zinc being one of the minerals, where does that come from? Does that come from the genes of the parents? Is it something that's preconception? Is it the diet that the baby is getting? I mean, where can you pinpoint that?
Sure.